Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Clostridium difficile infection, and we're looking at the diagnostic criteria. So Clostridium difficile infection, in short we are calling it CDI. So CDI diagnosis is a combination of these findings, that is the presence of diarrhea. So presence of diarrhea that is greater than 3. So 3 or greater than the uninformed stools. So uninformed stools, they are seen per 24 hours. So per 24 hours for greater than equal to 2 days. And there is no recognized cause. So there is no recognized cause. The second criteria being there is a detection of the toxins A and B. So there is toxins A and toxins B which are detected, and they are seen in terms of the stools, and this is by the presence of the PCR or the culture. So these two or by the detection of the pseudomembranes in the colon. So detect pseudomembranes in presence of the colon. To learn and grow daily like this, please do subscribe.